Hi, I'm Dr. Ed Laskowski, co-director of Mayo Clinic Sports Medicine, and I'm here to discuss with you today a recent study we performed entitled Youth Sport-Related Concussions, Perceived and Measured Baseline Knowledge of Concussions Among Community Coaches, Athletes, and Parents. Concussions are a very popular topic now in the medical literature, and the CDC estimates that there are about 2 to 4 million concussions occurring annually in the United States across all sports domains. But over 60,000 of these concussions occur in our high school athletes. So it's very important to, and the possible consequences of concussions, it's important to recognize them, because if athletes go back to play their sport too early, before their brain has fully healed after a concussion, they may be at risk for some devastating consequences. There is an entity called second impact syndrome, in which there is a disturbance of the blood flow of the brain. This can result in death and paralysis. And we really want to make sure that the brain is fully healed before an athlete returns to play. Each state now, all 50 states have legislation regarding when an athlete can return to play after a concussion. So it's important, number one, to identify a concussion so that we don't let athletes go back to play who may still be having the effects of a concussion they sustained. And it's also important to know when athletes should go back to return to play, what criteria need to be established. So this is our study really was designed to delve into the education that athletes and parents and coaches receive on this topic. They are our first line in as far as concussion identification and treatment and management. So we really wanted to find out what each of these populations knew. In Rochester, we have a nice situation because our athletic trainers are in the schools district, so they are well-versed in concussion, so they can educate our students and our coaches. Our physician staff, we have a very long-standing concussion program that we've been running in sports medicine that's very well developed. So it was very interesting. We had a good sample size that was represented in the study, so our athletic trainers distributed these surveys in the schools, so they made sure that they tried as hard as they could to get all our coaches on board, as well as parents and the athletes themselves. And some of the very interesting findings we found were about 1/3 of all respondents, only 1/3 knew that concussion was a brain injury. So a very striking finding that you'd think, well, boy, but interestingly enough, maybe our education is too good, and that we say, well, there's no structural damage to the brain. In essence, if we can do an MRI or an X-ray, CT scan, we usually don't see any changes in the brain structure, so maybe that's what they're thinking. And this is one of the first studies to look at each of these groups and compare results between each of the groups, and also between genders, and actually delve into each subgroup specifically, as well as between each group. So we wanted to find out who knows the most. Are we getting the education we need to across, or do we have some gaps in the knowledge that we need to rectify? As in many other areas in medicine, it's hard to really know what the patient is hearing sometimes when you talk to them, what they are remembering, what they translate back to their family. So we really wanted to find out how much our parents and athletes themselves and the coaches, how much do they really know about concussion? The knowledge of the concussion itself, when you should return to play, some of the consequences that you can have. But also maybe they're thinking it's just inattention, things like that. Maybe that really doesn't apply to the brain itself. So a very interesting finding that we need to definitely clarify in our education, that this certainly is a brain injury. And that, again, maybe would impact more severity to both the way athletes and coaches and parents perceive this. We found that our coaches did a very good job in the knowledge questions, that they really did know about concussion, really knew about also holding people out in the appropriate amount of time, and going through the protocol that we need to go through to ensure that people are symptom-free and safe to return to play. The coaches did very well. The athletes did very well in concussion knowledge. They knew about concussions in general. They were a little bit weaker on how you got a concussion, because you can get a concussion from a direct blow to the head, but a lot of concussions are also sustained from rotational force and twisting force. Now, these are the things that helmets really can't prevent against. Helmets can prevent against the impact somewhat, but not the rotational or twisting force. So students were a little bit weaker in that aspect of things. And they also were a little bit weaker on the return to play criteria as far as when it was safe to go back to play. All of them universally had shorter timelines between the time they got injured and the time they went back to play. Our parents, however, did very well in that aspect. As you can imagine, they were very concerned about their child's health. They wanted to make sure that it was safe for their child to return to play. The athlete, the motivation of getting back out there as soon as possible maybe impaired some of their answers, and the knowledge question of when it's safe to return to play, whereas the parents, perhaps more concerned about this and more concerned about being the right time to return back to play, did a little bit better in that regard. We're going to use these resources and use this data really to guide us in our educational efforts. We find that a lot of people don't necessarily use the physician visit. They use media, they use internet sources, other forums to get their information about topics. So targeting the education, we kind of tried to stratify where people got their educational knowledge too about concussion. If we can stratify and target that better and to the more mediums that they use more frequently and more consistently, that may lead to better educational efforts. We need to really hammer that this is a brain injury, that this is a serious condition, and both from the athlete, we know they want to get back as soon as possible, but we need to have the education that, hey, this is why you're doing what you're doing as far as the return to play protocol. This is why it's staged. We really want to make sure you're safe, and if you go back too early, bad things can happen.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.